there are two types of monsoons in my mind. One which happens indoors and one which happens outdoors. And I'll tell you a little bit about it. I recently got invited to this party and we were all asked to wear cloud couture, which meant we went in indigo prints, and those of us who had the skill to blend various colors together had some beautiful eyes, all blues and purples, and it was great fun. We went there and we had monsoon mojitos, and there was a singing in the rain photo booth for couples, and I actually took down the names of the food there just so I could share it with you. This is why I go to parties, so I can take notes and come and have something to talk about. But they had puddle pakoras, lightning laddus, megh malpua, and rainbow rasam. And it was so much of fun. And I loved it. And we were all just thinking about, monsoons from our childhood, what it felt like, when the first rains come after, the heat of the summers. And it was incredibly, essentially, a very, very romantic get-together, a celebration of the rains. And just outside, there was something else happening, where the flyovers had become waterfalls and the roads had turned into rivers. Potholes had blossomed overnight and the traffic lights just kept blinking uselessly. There was this weird thing I've noticed this year where I've realized in Delhi especially, the pollution has been mixing with all the humidity, and it's like this really strange kind of a haze which comes up at 5 a.m. in the morning. I've never seen it before in all my 38 years of having lived in Delhi, but it's happened this year in the monsoon. And it just made me realize, for all the beauty and the poetry and the songs and the films that we attach to the season, it's actually not a lover's party in India. It's a yearly reminder that how quickly our life can just get stalled and how quickly our health can just change. And so I thought that while the monsoon that we have indoors, there's plenty of inspiration for that, we don't seem to talk enough about the monsoon that's happening outdoors. We can't do anything about the jams and the waterlogging as individuals, but we can definitely do something about our health and our well-being. And so we have with us today Dr. Rituja Ugalmugle. She is an internal medicine consultant with Wockhart Hospitals in Bombay. She's right in the middle of the downpours, so I'm really glad that she's managed to come and join us. Hi, doctor. How are you?
Hello, thank you so much. Yes, Mumbai is crazy right now. The last 2 days have been really, really bad. So we have to look for a small window in which we can try to escape the house and reach the hospital. And as you rightly mentioned, Mumbai or monsoons, as romantic as they sound in movies and poetry, when you have to step out, it is not as fun. And especially people who are not privileged enough to be staying in high rises and in very well equipped areas, people who have to walk through rainwaters and maybe have leaking roofs, or maybe people who don't have roofs over their head, it is far from romantic for them. So yes, I mean, last 2 days has been a real realization, like another reminder of the same harsh reality.
You know what? For me, I think this year the rains have become an equalizer. In a way, it doesn't matter that I'm living in one of the poshest neighborhoods of the capital of our country. I stepped out, and the main road, which is the outer ring road, it was so flooded that the water was coming up to our waist, and it wasn't even stagnant water. It was moving. There were rapids, and there were electric wires that were getting submerged in all of this. And that's where I actually got the idea, because I saw so many office people just wading through these dirty waters, and And I was thinking, what do we do? Like when we come out of them, do I disinfect my legs? Do I take a vitamin C tablet? Do I take those fuzzy gummy bears for immunity? Like, what do I do? And that's why I really wanted this to be a very comprehensive episode on monsoon health. So could we start by talking about waterborne diseases, your diarrheas and choleras and typhoids, which, how does one stay safe?
So, you're very right that waterborne diseases do go up. We see a increasing number of cases of gastroenteritis, people falling sick with diarrhea, loose motions, abdominal cramps, and it really, really, really dehydrates them. So the first and the most important thing over there would be hand hygiene, and where you wash your hands with water and soap before consuming any kind of food. And as much as we may have craving for street food in monsoons, right, we have to really control that. So because in Pune especially, for example, recently we have seen a significantly higher number of cases of food poisoning, because the street food that people consume is not very, very safe, for example, right? So if you do have cravings, I would suggest that stick to home cooked food. Try to make those pakoras at home. And even if at all you are having some outside food, make sure that it's fresh and it's cooked food. Avoid having raw foods or any uncooked food, because your samosa or pakora may be hot, but the chutney which they give with it, or the golgappa or pani puri that you have, the water in it, that may not be very safe. Because not just your typhoid or cholera, but we also have a lot of cases of hepatitis, where the liver gets inflamed and the liver enzymes go up. And if you have typhoid, then at least you can take some antibiotics. But for hepatitis A and hepatitis E, for example, there is no antiviral which you can take. So then that treatment will be supportive. And although most cases of viral hepatitis are very mild, and all you need is lots of fluids and supportive treatment, but sometimes these cases can become can cause a lot of inflammation of the liver and cause what we call acute liver failure or fulminant liver failure.
Yeah.
And especially pregnant women have to be very, very, very careful of this, because pregnant women are at an increased risk of a slightly more severe hepatitis infection if at all they get infected. So while we need to take precautions at home, but when we do go out, make sure that at least you're not having uncooked food. You're having only cooked food, cooked fresh in front of you. Not that something it is cooked and then kept to become cold and just reheated and served to you again.
Yeah.
So that is something we will have to be very careful about.
One thing, because I really like to bring my own experiences into this. Sometimes, when you're walking on the road and, you can't help it. Some of that dirty water gets on your hands, right? And I'm not always the most careful of hand washers. So how much of a risk is it that, if you end up touching your face, or even if you're not consuming food with your hands, but just using your hands, can that also lead to some sort of infection?
Not food poisoning per se. So I would suggest that first, do not touch your face. If your hands are dirty, use at least, if you don't have access to clean water at the moment, at least use sanitizer. Yeah. So no good if you have to look at something positive that you got out of a horrible situation. I think
it's horrible. Sometimes you have that dirty water on your hand after going on the metro, and then and I keep telling myself, wash it, and I get to the office and I forget, and then I'm touching my face and it's awful.
So that's what I was saying, that when for example, COVID was a horrible thing that happened, but one thing which a lot of people became aware of because of COVID is sanitize. Even if you don't have access to clean water right away, sanitize, right? So at least carry your sanitizer with you. If you don't have access to clean water right away, make sure that you're at least sanitizing your hands before consuming anything or before touching your face.
Right.
Because it's not just food poisoning, right? There are all sorts of bacteria and viruses around. So you're touching your mouth,
Right.
you're touching your nose. And yes, flu
Mm.
is also something which happens in this season. Like, you can also acquire respiratory infections. So that's why it's important. Yeah.
Yeah, I really wanted to get to that one next. The burden of monsoon on our respiratory health. Um, you know, so firstly, I've always wanted to ask a doctor this, because it's every auntie I have tells me this, that in the monsoon period, once you're sweating and you come inside and you drink cold water and you go into the AC room, that is the reason you've got the flu. I don't know if how that matches up to a virus being born in my throat, but I really want you to tell me, what is it about this, sudden change of weather that causes the flu? It can't be the AC.
So no. So although you are right, and that virus is not born in your throat because you are in the AC, but the aunties have a little bit of point over there. So viruses are everywhere, all the time. Bacteria are everywhere all the time. And they've been here for way longer than humans have been here. So they're way smarter than us. So what normally happens is, even if there are a lot of bacteria and viruses around us in the air and even within our bodies, in our throats, we do have them. But most of the time, our body is very, very effective in fighting them. Now, how does it fight them? At the surface level, even at the mucosa level of the inner lining of the nose and the mouth and throat, that has to be intact. And when there is a sudden weather change, that's when the body's response changes a bit. The temperature change is also something which increases. Suddenly there's more humidity, so more bacteria and infections can propagate, right? So when we drink a lot of cold water and then go in the AC and things like that, the mucosa may get affected, the inner lining of the throat, which is now trying to fight the infection, that may be a little strained. So then the infection enters and it increases. So it's just the balance of viruses and bacteria always being there and your body trying to fight it. When that balance is tipped off, that's when you acquire. So it's not like you grow viruses because you're drinking cold water, but it is a good idea to drink slightly warm water to soothe the throat. When the throat is soothed, it will be in a better position. Like, it will cause less irritation, right? Simple things like that. So even when you have a cough, for example, so it's not like drinking your kada and honey is going to kill all the viruses. No, but it is going to soothe your throat. It is going to repair that lining, the damage which is caused. It is going to repair faster if you take care of yourself better.
Right. One thing that has really struck me as well this year is that, like, we're talking about climate change, that, these monsoons are more extended, there's sudden bursts of really hot days, and then, it's just raining, the temperature is fluctuating. So there is definitely a seasonal change, but with it, there's been a change in our respiratory infections as well, right? I can't ever remember flu having gone on for so long in me. Of course, my husband's had it because I'm growing old and I'm aging, and that's why. But I have spoken to a lot of pulmonologists, and they are reporting that, flu is getting a little bit more severe. Well, flu, common cold, pneumonia, COVID, we don't know if it's there or not there, but all these flu-like infections are getting a little bit more severe, and I find there's a lot of panic around me. When I discuss this with my friends, it'll be like, oh, it's weight, start doing crunches, that will make it better. It's all the abdominal fat, or they'll say, it's the fact that we all have BP or diabetes, or we're having junk food, and it's like we're trying to grasp at straws to explain it. What is the real reason?
So, very important question, because everything that you mentioned, all of those theories I have heard from my patients, and I keep hearing new theories every day of what is going to make their immunity instantly better so that they are fine the next day. They come in with a cough and cold and they say, give me something now because I have to fly to Delhi tomorrow because I have a meeting. I can't miss it. So there is unfortunately nothing magical that can happen. It is always going to be a balance between how severe the infection is, how violent the pathogen is, versus your immunity, how it is trying to fight it. Okay, so there is obviously definitely a lot more pollution in the air. So it is not, even when you're not sick, your respiratory system is fighting bad air at all times. So anyway, your airways are more reactive now because they are looking at the polluted air which you're inhaling is looked at as a threat, by the body. Also, when you have a viral infection, for example, sometimes some people get a flu and the infection subsides, the fever goes away, everything is fine. But for weeks or for a few days after that, they're saying, oh, I'm still having dry cough. I'm still having dry cough. So a lot of times there's also this airway hyperreactivity, So when the body has fought an infection, it is still acting in that exaggerated immune mode that, no, I have to throw everything out which feels like an infection. So, this nagging dry cough which happens after
it's awful.
Yeah,
it's just
so
awful
that's
then.
because your body is trying to protect itself. It doesn't want to get infected again. So sometimes just symptomatic treatment for that is enough. But at the same time, what is important is to consult a doctor, because there are two extremes. There are some patients who even for the mildest of flu will want to get all the tests done and give us everything and antibiotics and antivirals and all of that. There's another group of another extreme where fever is going on for a week, and only when they become so breathless that the oxygenation starts going down, that's when they think that, okay, now it's time to go to the emergency room and see a doctor. So either of those are not good. So while you may wait 24 hours for a fever to subside and try to do your home remedies like steam inhalation, gargling with salt, warm water, drinking warm beverages, all of that. But if you feel it's been 24 hours, then things are getting worse. They're not getting better. I'm coughing more. There's more phlegm coming out. Fever is rising. That would be a time to get tested by the doctor. Depending on what your symptoms are, the doctor will decide what kind of tests are right for you. And pneumonia is, for example, when the infection is in the lung, right? So there, drinking your kada or gargling is not going to help. You're going to need something which is going to take care of the infection which has happened in the lungs, for example. So it is, which is why I would say that I would not want to oversimplify things over here. But the message I would like to give is go meet your doctor. As far as the other thing which you made, immunity. Yes, getting older is one factor, as the bodies are not as resilient, and metabolism does slow down a little bit with age. But immunity is again not, there is no magic pill that you can take that, take this thing and you will achieve the perfect amount of immunity. Because again, this word is very loosely thrown around, that although there are also diseases where the problem is the immunity, where your body is trying to fight everything and there's exaggerated immune response to everything. We don't want that either. So immunity is something, no one pill is going to take care of it. If you want a good immunity, you're going to have to take care of your body as a whole, which means taking care of your sleep. Are you getting a good quality sleep at night, restful, uninterrupted 7 to 8 hours of sleep every night? That's something you're going to have to look at. Are you exercising regularly? Are you having a balanced meal? Are there enough salads? Are there enough fruits? Is your meal in general rich in your vitamins? Are you checking your vitamin D levels? That's not something you're going to get much from food. That's something your skin forms on exposure to sun. So what are your vitamin D levels? What are your B12 levels? So those are the things which we have to take care of. What are your stress levels? How stressed are you? So if you can't be running in, hustle mode and over-functioning mode at all times, not giving yourself enough rest, and when you fall sick, even then that's when you fall sick, that's when your body is crying for help, right? I need rest, I need to recover. And I have patients who have fever today and ask, can I go to the gym tomorrow? Because they think gym is good for the body. It's going to be good for my immunity. Not when you're sick. When you're sick, you need to rest and restore, right? So making sure these everyday small habits, drinking enough water, staying well hydrated, staying well rested, trying to manage your stress a little bit. All these things are important for immunity. It's not just your vitamin C, which is going to like popping vitamin C every day and getting only 4 hours of sleep and being overworked and overstressed and not having a balanced meal, not having time to eat on time. These things are not going to help your immunity.
I hear you, but I'm still extremely proud of my immunity drawer, which has gut health gummies and these incredibly tasty ones. Like, I actually have these because they're so tasty.
Yeah,
And
no, it's good. It's good. I'm not against supplements and multivitamins.
It has like 52
No, no, no.
vitamins
I
and
agree.
minerals, and it's this fizzy, tasty thing. So I'm very proud of those, though.
No, it's good.
I
It's
think
good that you're taking care of
it's a
your
placebo
health.
effect.
Yeah, yeah. It's
Yeah.
good that you're taking
And,
those
and it just
supplements.
makes me feel nice. I mean, my husband says, "What's that awful thing you're having?" And I'm like, "It's the flavor of health," you know. It, and I like it. Quick question: if I have the common cold, right? Can I get the influenza virus or the COVID virus immediately thereafter because it is a different virus? Can you get multiple infections by different viruses, one after the other?
You can
It's
get
possible in
multiple.
theory.
Yes, yes. You can get multiple viruses. You can get multiple infections. Even otherwise, even the non. So there are tests where we find out which virus has affected you. Where we take a throat swab or take a sputum sample and we send it for testing. Those are very expensive tests. So we normally end up doing it for only patients who have insurance or something, or people who are really sick and are not getting better, and we really need to find out. But yes, when we do those tests, we do find out that one person may get multiple virus infections at the same time. The thing about viral infections is most of the time, the treatment is going to be symptomatic because your hydration, rest, or depending on the respiratory symptoms, whatever respiratory treatment is prescribed to you, that is going to be the key. But if there is a bacterial infection, then you're going to need some antibiotics. So that is another thing which I would like to emphasize, that just because you have a sore throat, please stop popping azithromycin, augmentin. I have so many patients who before they reach the doctor, they've already taken their, I had a sore throat, so I took Azi for one day and then I felt better, but then it came back again, so now I'm here. So antibiotics are not symptomatic treatment. They are not like your hot water gargles, or they're not like paracetamol. You have a headache, you take a paracetamol and you feel better. Antibiotics are specifically to kill the bacteria. Now, if you're not sure that you have a bacterial infection, then your antibiotics are actually going to do more harm than good. And because there is so much abuse of antibiotics by patients, because they're so easily available around the counter. So we also have patients who just go to the chemist and ask for medicines, and they take whatever is prescribed, right? They don't even need a doctor's prescription.
Chemists are great doctors.
Yeah. So which is fine for symptomatic treatment.
What are you saying? They've done their own MBBS through ChatGPT.
So, but what happens?
Does the delivery, he knows also.
What happens as a result is when we do get actually critically ill patients, when your own parents come to the hospital and all. So when we get these really bad infections, we are getting so much of antibiotic resistance because of this, because for every little illness, everybody has been taking antibiotics, incomplete courses, not antibiotics when it is not required, antibiotics at the wrong strength, wrong duration, all of those things, no? So when people actually fall sick and we have to treat somebody who really has a bad pneumonia, there are drug resistant, and then we are in the fix. So we don't want that to happen to us, right? When we grow older and we end up in a hospital, we don't want drug resistant bugs infecting our brains and lungs and kidneys, right? So it is important to not self-medicate, especially with antibiotics. Yeah.
What's, now that you mentioned the elderly, for me, I think we take a cold or anything flu-like so lightly because, most of us can recover. But we forget there are a lot of people out there, especially the young, the elderly, those on chemotherapy or, those who are recovering from serious illnesses. For them, it can turn deadly so quickly, this one infection. And in terms of social responsibility, I think sometimes we take our colds and coughs so lightly. It's actually something I do as well. I'm guilty of it. But, it is worrisome, when I think that, maybe if I hadn't gone out somewhere and met somebody, I didn't think twice whether this person has somebody sick back home. So, I think COVID did teach us a lot, but, we forget. That's unfortunate. Um, Moving on, I wanted to get to, mosquito-borne infections, which is also really taking off now. Your dengue, malaria, chikungunya. Now, tell me the role of stress and hydration and rest in all three of these. Because we all know platelet counts, we all know all these other things, papaya extracts and everything. Tell me the importance of stress, rest, and hydration.
So, more than that, first thing is protection against mosquitoes, because these are not, it's not just only people who live in slums are going to get affected by this. No, even people in offices, anywhere there's water stagnation, anywhere there are mosquitoes, it takes just one mosquito bite, to get the infection, right? Whether it is malaria or dengue or chikungunya. Um, Even over here, I would say first is get tested. Don't ignore any fever as, oh, it's just a fever, it'll go away. Because if treatment is started on time, then it can really, really help. So, because malaria, for example, there are specific anti-malarials. So, if you start your anti-malarials on time, the chances of your platelets going down, your liver enzymes going up do reduce. So getting tested and starting treatment on time for malaria is going to be important. As far as dengue and chikungunya are concerned, the most important thing over there is going to be your rest, hydration, and symptomatic treatment. So drinking lots of water and giving your body the rest that it needs, because what happens with good rest is the recovery is faster. If you don't give your body the rest that it needs when the time is right, then something which would have gotten better within 5 days or 7 days can prolong for weeks together. So it may not affect so much in terms of platelet count and all those things. Now that will depend on your immune response versus the virulence of the virus. But how you feel, how quickly you recover will depend to a great extent on how well you hydrate yourself and how much rest are you taking. So even over there, just multivitamins, which the doctor prescribes you, depending on what is the right combination of multivitamins for you, and staying well hydrated. Because in chikungunya and dengue, for example, there's a lot of joint pain, backache, weakness, fatigue. There are people who have weakness for weeks together. There are people who have joint pain and stiffness for weeks together in chikungunya, for example. So over there, hydration is going to play a big role. But another thing I would like to mention over here is even papaya leaf extract, avoid taking on your own. It is only when the doctor prescribes it that one should take it, because, like we discussed earlier, there are combined infections. Sometimes people may have already vomiting and diarrhea and things like that along with your dengue. We do see a lot of patients with mixed infection. Like I'm also seeing patients with 2 types of malaria and 1 type of dengue all affected at the same time. So these kind of cases especially avoid self-medication, because when a doctor prescribes something to you, they are aware of what to expect in terms of side effects. But when you self-medicate, we are not always aware of what to expect. Will this cause vomiting? Will this worsen my hepatitis? Will this worsen my liver function, for example? So even something which sounds harmless can sometimes not be tolerated by your body. So please consult your doctor even before taking any kind of extracts.
Yeah, and I just wanted to make a quick thank you to all, the scientists and researchers who are working to deal with these mosquito-borne illnesses. Some of their work is so fascinating. In fact, I think the ICMR Vector Control Research Center in Puducherry, they were developing these sterile mosquitoes, male ones, which are extremely sexually active. And when they go out, they mate with the females and they'll basically not have any eggs, which are the ones which end up infecting us. And I found it so interesting that they've even developed a way to artificially feed these mosquitoes, because you can't keep giving them human blood or whatever blood they need. So, I mean, I don't think we celebrate these people enough. So I just thought this episode would be nice to, really think about all these people who are working with these things that we hate, and they see them every day just to keep us safe. So, yeah, there's hope yet, right?
Absolutely.
Now, the last thing I wanted to talk about was fungal and skin infections, which is, of course, again, a result of contaminated water. Now, a friend recently very graciously pointed out to me that the water on the road will probably have rat urine, because rats are in the gutters and it's coming from the gutters, and the rats also need to urinate. It has made me paranoid. So I don't think so much about my hands, but my feet, I'm like bathing them in alcohol. I'm not joking. 100% pure alcohol. I'm pouring it on my feet because it's just freaking me out so much. I think that's too extreme. But what should one do? Because your feet are getting exposed, your nails, and there is, I believe, something called rat fever as well, and all sorts of fungal skin infections. So, what do you do after your skin comes in contact with dirty things?
So you did mention something very interesting about rat urine being mixed with the rainwater. It does cause a very serious infection called as leptospirosis. I don't know if you've heard of it. A lot of people, like for example, there's a lot of awareness about dengue malaria, but a lot of people don't know about leptospirosis. Now, leptospirosis is something which will again present just like a fever with chills, right? You have fever with chills, but how it enters the body is if you have cracks on your feet, or if you have an untreated or unattended wound. If your skin is intact, it is unlikely to penetrate body. So again, just like I said, no, the throat mucosa will protect you from the respiratory thing. So intact skin, if your skin is intact, it doesn't have ulcers or cuts or cracks, then you're more or less okay. Then just washing it with water and soap is going to be enough. But if you have broken skin, or if you have skin which is not intact and it comes in contact with water which is contaminated with rat urine, then you're likely to get then you're at increased risk of getting leptospirosis. Now, leptospirosis, what is scary about it is it in a lot of cases can affect the liver and the kidneys. Just to give you an example, a few weeks ago we had a young chap who presented with just 2 days history of fever, but when we ran the tests, his kidney function was very affected. Now, this person was 24 years old, not a diabetic person, no past history, not otherwise very fit and healthy, but via the kidney suddenly this thing. So that's when we suspected that he could have leptospirosis. Now, because this person came to us in time, we started the treatment properly on time. He was fine and recovered very well. But another scenario where if this patient would have decided to stay at home for 3 more days, it is possible that he would have ended up requiring a dialysis. Now, this is not to scare people. This is just to increase awareness. Not everybody who gets leptospirosis requires dialysis. Not everybody who gets dengue needs an ICU treatment. But I'm saying that timely consultation with a doctor, timely testing will help detect. So here in this patient, we were really able to get him back on track without doing anything very aggressive. Just a simple antibiotic which is suitable for leptospirosis was given, and the patient really recovered. So what you have to make sure is your skin is intact. There are no unattended wounds. Wear proper boots which cover your legs. Whenever you are in a safe place, like when you come back home or you reach your office, it is a good idea to wash your feet with soap and water. Soap and water is enough. You don't have to use,
not pour expensive alcohol on your feet.
Yeah, that's a bit of an overkill. So just soap, water, and what is important is keeping it dry. Like, a lot of times people are in a rush. They go to even other than monsoons, right? There are people who are in so much of a hurry that they go to the washroom, come back, wear their socks before their feet are also completely dry. Now, this is especially important for people who have diabetes, because patients with diabetes, anyway, the sensation over the feet may be slightly reduced. So one may not be very aware of how dry or wet the skin is, or if something is pricking us, or if there's any unwanted foreign body over there. So especially for diabetic patients, and they are also at increased risk of fungal infections. So especially for diabetic patients and the elderly, washing feet after coming back home, making sure that they're clean, dry, and then wearing your other footwear, whatever you're in. So keeping it dry is also very, very important, because wherever there is moisture, which is let to be between toes for a long period of time, then that will increase your risk of fungal infections. So monsoon specific.
Also, a really bad season to get any body piercings or well, tattoos in my case. It's quite risky actually. The wounds don't dry out the way they would in the winter and the summer. Um, just to end this, I was very curious to know a little bit about your own monsoon experiences when it comes to health and well-being. What does this season sort of mean for you, and what have your experiences been like this year
So
in
in
the
the
OPD
OPD
and
and
outside?
outside. Yeah. So, yes, monsoons have been really, really bad. Commute has been bad. A lot of people don't always have the option of staying at home. People still have to get out and reach their workplace. So they will especially have to take care. And the emergency rooms have been flooded in our hospital because there are, more patients in the queue and waiting to get a hospital bed
Wow.
because of dengue and malaria and a lot of mixed infections.
Oh, flooded with people, not water, right?
Flooded with people, patients
I
waiting
was
to get
like,
into the
gosh.
hospital with fever. Lots of cases of fever. Some will have dengue, some will have
Right.
malaria, some will have mixed infections. We're also getting a lot of people with mixed infections. So when somebody comes for fever, we have to run the whole battery of tests to find out you can't just assume if it's malaria, it's only malaria. You should also need to
Right.
test for dengue, for example, right? And
Yeah.
there are patients in whom we have an exaggerated immune response, for example, because if two infections are at a time, body's trying to really hard to fight it, and sometimes that's not good for the body. But with proper care, timely assessment, timely management, most of these patients have responded really, really well. Even the flu cases, although we've got different types of flu, um, it's not looking as severe, at least in Bombay, is what I would say. The number of cases is high, but like if we also got a few cases of COVID, for example. But fortunately, these were all mild cases who could be discharged very soon and did not require any excessive oxygen and all. But dengue, malaria, chikungunya, these have been the ones, or even food poisoning cases, gastroenteritis cases. Now, these have been the ones which have really needed a lot more attention and care. And also, like I said, mixed infection. So you also had somebody who has dengue but has a recent history of having street food outside, and they have also a simultaneous hepatitis A infection. So two viruses coming together causing inflammation of the liver, and then a slightly delayed recovery because of nausea, vomiting, not feeling like eating. But even over here, then the holistic care, a proper care, and a proper trust between the patient doctor. You have a lot of times it is also about pacifying the patients and letting them know that this will pass, this will get better, you're on the right track. And because there's also so much fear and panic, right? That you are always aware of the worst case scenario. Oh, somebody died of dengue, somebody died of this, somebody ended up in ICU because of that. So I would like to really urge patients to not always go to the worst case scenario of what can go wrong with them, because the fact is majority of the patients do get better. So if the doctor is not panicking, you should not panic, is what I would like to say. Right. And also getting vaccinated, like flu vaccines. People should take annual flu vaccines every year before the monsoon begins. Towards the end of your summers would be a good time to take flu vaccines. So in case you do get a flu, it will be a milder one. Especially for children, school-going children also, we should be giving them flu vaccines. And elderly children, everybody, I would suggest everybody should go ahead and get annual influenza vaccines.
Thank you so much for being so detailed on this episode. I I think we've covered pretty much everything. But thank you for your time.
Thank you so much.
I just want to end this episode by sharing something that happened just 2 days ago. I was seeing a lady in front of me, she was running to go to office, and there was some amount of waterlogging. She tripped, she fell, she hurt herself, and she still wanted to go to office. And I remember looking at her and thinking at that time, do you not feel like your health is worth as much attention as your job? Do you not feel that you are worth, taking that day off? Even I know some people don't have the choice, but you're still worth fighting to make sure you have that choice in life. So to anyone listening, if it's raining too much and if you can afford the luxury of a day off, then please do know that you're worth it. Sometimes me and my friends, we have this little group where we have to remind ourselves that we are worth taking a day off when it's flooded outside. There's no point earning a little extra if we're not even going to be able to live to enjoy it. And it helps me, and I hope it helps you too. Just to let you know that if you've enjoyed this episode, please leave us a rating. Or if there is a specific health concern or a doctor you'd like to hear more from, then you can write to us. We're available on pods@indiatoday.com.